Virus pandemic changes every day. So tonight we have Dr. Shira Doron, hospital epidemiologist at Tufts Medical Center, here with us to help us interpret it. Thanks for being with us. I want to talk about these, more than a dozen different protests today in Massachusetts. The state still prohibiting large gatherings, but leaders saying they're not going to discourage these demonstrations against racial injustice. People do have that right to make their voices heard. What could the consequences be for public health, though?
I hope and I believe that the people in Massachusetts who are demonstrating for their values and what they believe in have taken to heart the advice of public health officials and the governor about the things that we need to be doing to prevent the transmission of COVID-19. So distancing, mask wearing, cleaning one's hands. And I think that most people are still doing that during the demonstrations.
We have seen a lot of people wearing masks. I think you're absolutely right. And even taking hand sanitizers, organizers encouraging people to do that. Let's shift a bit to these warmer temperatures we're experiencing. Is there any evidence that these warmer weather, does it have an impact on coronavirus?
Well, we are seeing warmer weather and we are seeing good numbers in terms of declining cases and declining hospitalizations for COVID-19. That doesn't necessarily mean that they are related, though. And we have to be careful. It doesn't mean that we can ease up on the things that we've been doing, as I said. We do know that in the Southern Hemisphere, they're seeing a lot of cases and it is their winter.
Yeah.
So we are going to need to be careful when the temperatures fall again to see if it starts to surge back up.
That's a good point. A lot of families, though, I think trying to figure out their summer plans, if they have them. Do you think that trips to another part of the country are off the list? Like, would it be safer to go to the Cape or to the Berkshires or just stay in New England?
Well, here in Massachusetts, we've been in the hot spot.
Right.
And there are many parts of the country that are probably a lot safer than this one, especially if you get in your car and drive there. Now, whether there will be a two-week quarantine when you get there is a different story.
So check where you're going, in addition to, obviously, what we know here. Finally, this caught our eye this week. A new study by European scientists found a link between blood type and the way coronavirus could impact someone. Can you just tell us about this a little bit?
Yeah, so this is in the category of very, very early research. In fact, not even yet peer reviewed, but very exciting research potentially. We've been wondering, what is it that makes one person get severe disease and another person not even have any symptoms at all? And, certainly it's possible that genetics play a role. And in this study, they looked at a large number of patients and seemed to find an association with genetics and particularly the genes that encode blood type. And so there may be some relationship there and a lot more research is needed.
Okay, early days, but maybe something to watch. All right, Dr. Doron, thank you so much for your time. As always, we really appreciate it.
You're welcome.